Hey everybody, my name is Tony Khoury. I'm the Executive Vice President at Project Pharma, and I want to thank Meeting on the Med for having us here today. Going to go through Project Pharma, who we are, what we're all about, our patient-focused mission, our services in the space, and our unmatched credibility in the advanced therapy space, specifically cell and gene. Um, so thanks for having us. Let's rock and roll. So Project Farma at a glance, it's really proud to be a part of this organization. We have a world-class culture focused on the patients. We founded the company actually with the words patient focused. That's why we have the F in pharma, and it's basically embedded in our DNA. As an organization, we proudly and humbly been a part of two of the first four cell and gene therapies ever commercially approved in the space. Our business is focused around technical operations, strategy, and execution. So we'll do anything from tech ops due diligence when evaluating an investment in the space or evaluating the readiness of a company or getting them up and running. We'll lay out the manufacturing strategy, look at capacity models, what type of manufacturing solutions are needed. Make versus buy is a very common evaluation that organizations humbly to be a part of. A lot of owner representative needs out there. So we do a lot of owner roles where we evaluate, how we're going to take the company and fill those roles, and basically mobilize the company. And then we'll execute that work. So across the whole breadth from engineering, validation, automation, quality assurance. Been part of 40 facility builds in the last 4 years alone, over 4 billion in CapEx under management for our clients. So we take that very seriously. 80 plus CDMO engagements. So we'll evaluate the companies. We'll basically, find what's right, do quality agreements, auditing, and, mobilize those companies, tech transfer, and truly establish a healthy partnership so that we can make a great success story out of these miracle medicines. Unmatched credibility is, right there on the front. I think we've touched on that. Been a part of the largest manufacturing footprints in the world. And now we're a part of Precision Medicine Group. This happened mid last year. Private equity backed by Blackstone, TPG, Berkshire, Vida, just a few notable names there. Multi-billion-dollar organization is our firm as a whole, and humbly been a part of what we call Precision Advance. And basically, that's the whole goal there is trying to find more efficient ways to move the curve forward and bring products to the patients in need. And that covers clinical trials through our Precision for Medicine group. So that's biomarker data, qualifying and setting up the trials for patients and mobilizing the science there. We're the middle piece with the tech ops, manufacturing strategy and execution. I'm sure that's been a hot topic. And then commercialization, the precision value and health, where they basically commercialize products and look at, payers, payees, health insurance companies, pricing structures. So it's a really special group that really brings it all together in the clinical manufacturing commercialization. Right now, actively, I thought I'd share, what are we doing today? We're really, it's amazing to see in the last 6 years how we've gone from just a few to now working on actively over 100 life-saving therapies. Really humbled to be a part of this. These stories, it never gets old. It's the reason why we wake up in the morning. It's so meaningful, and it's embedded into how we operate as an organization day in and day out. And I wouldn't have it any other way. And I'm really thankful that Project Pharma asked me to represent the organization and take you all through this. I'm really proud to be a part of a culture that really puts the patient at the front of our minds. Sometimes you lose sight of that, right? And investing in that and keeping that at the front of everybody's minds, it changes the way you approach every day. And having that integrity is important. And our firm is big on that. And kind of corralling the group and putting that brain power towards something so meaningful, wouldn't have it any other way.
I'm so thankful to our team for embracing our company's mission and values and taking them to the next level. It's amazing when I hear our clients commend our culture and they ask for our advice on how they can instill that same culture in their organization.
Since day one, our leadership team has done this great job of cultivating an environment based on philanthropy. It's been built into the foundation of Project Pharma since day one. It's really the why behind what it is that we do, and it's very easy to get tunnel vision in the projects that we work on. So it's nice to be able to connect with the community, connect with the patients, and be reminded of what it is that we're working towards.
So let's knock through about us at Project Pharma. At a glance, this breaks down our, credibility and experience in the advanced therapy space. Cell and gene therapy, we've done everything from, 500,000, 5,000 square foot facility up to 500,000 square feet. Tons of single-use technology, cutting-edge technology. I'll tell you, it's always fun to hear, how challenging some of the technology is in the manufacturing space today. And I always go, we should be fight back 5 years ago, because I feel like we're in a lot better space and, a lot better position. But we'll continue to evolve that tech, and we collaborate with different manufacturers of different equipment and technology to get the equipment up to what we need in the space to commercialize products. So it's been really great to be a part of that. As a whole, organization is, a couple hundred employees full time. So we're, offices all over the world. We'll touch on that, and our partnerships in the advanced therapy space, humbly over 40, 50, actually 50 plus partnerships in cell gene therapy. So tons of experience and know-how there, and humbled to be a part of that. This is our playbook. I think this is important to hit on for the organization. So the advanced therapy manufacturing playbook. Once we realized what was happening and the massive demand that was taking place here in advanced medicines, we really had to take a step back, and we challenged ourselves, and we challenged our organization and all of our collaborators to think about how we could go faster and be compliant. And what we found out was there was a lot of patterns with how we were partnering with clients and what they needed immediately to start up their organization. And that's what inspired the Advanced Therapy Manufacturing Playbook, ATMP, which we kind of, paralleled off of the ATMPs in the space. And in this, it outlines our business strategy, group identifications to ignite, organizational charts, job descriptions, and give folks the right talent that they need. We obviously have a massive network to handpick and connect folks, for the right opportunities. Build out the facility and process requirements, policies, procedures, quality management systems. Ignite both a capital projects program and org chart, and then there's an operations org chart. When they are different, and the capex can roll into the opex, but laying that strategy out, and then just getting people in the right position to succeed. Quality management systems, policies and procedures, training and development. That's a big one in the space for sure. Here's a glimpse of where we're at as an organization and where we're working as we continue to expand our footprint internationally. And, these diseases are everywhere, and we really need to be accessible and share our knowledge across the globe, and help really mobilize success for all the companies out there with their great missions. Thought leadership, giving back to the industry. This is something we really put a lot of time and energy into, and why we're involved with Media on the Mesa today. And it's important for us to look at thought leadership and giving back, and how we're speaking to, hey, what's the latest in advanced therapy pods, or what are the strategy around COVID-19, or best practices to evaluate CDMOs. So we really are doing our best to write those articles, speak at different conferences, and really make it focused on ways to share knowledge and truly be collaborative in the space. All of the success that we've had to date was done with a massive group of organizations, from different A&E firms, CM firms, equipment vendors, automation collaborators, and clients and customers. And it truly takes a team approach, and takes collaboration and knowledge sharing to be successful, and to bring things to market safely and compliantly. So our services, what do we do? Right now we're working with, massive amount of life science companies, 50 plus in cell and gene. We've already covered the types of services, but this kind of gives you the types of companies. So we'll work with academia centers, we'll work with private equity groups, and we'll evaluate different types of strategies to roll out new cos and subcos and what that all looks like. We'll work with small, large pharma, universities, hospitals, nonprofits, government agencies. So this kind of gives you a glimpse of the types of collaborations we have in the space and what we're doing. Today, we have a PF strategy group. I'm humbled to, lead this initiative across our organization, and a great group of team, experts. And what we're doing there is we're doing a lot of strategy around positioning companies well, evaluating the right investments for those companies around tech ops and manufacturing, how we can create value for those companies so that we can properly position that firm, and be smart with what type of investments we make and what kind of phases we do that in, all in efforts to mobilize the science. all in efforts of mobilizing these miracle medicines, and all in efforts of getting the products to the patient safely and compliantly. So that's at a glimpse of what we're doing there. We've led over 25 make versus strategies, make versus buy strategies just in the last, I would say, 12 months. It's been a really big demand, and we're trying to solve those problems. And there's always a hybrid solution. It's not one or the other. I'll tell you that right now. This is a glimpse of what we're doing there on the tech ops strategy group. So we'll do the due diligence, make buy, business structure, project management, CapEx, laying that out, the CapEx, OpEx, ROIs, and comparison of external versus internal, and how we tech transfer into CDMOs or into internal capabilities. Could go on and on about this, but this gives you a good glimpse. This deep dives into it a little bit, one by one, of what we're doing as an organization. I will hit on the business infrastructure piece there in the bottom left and on the left side. So a lot of companies are brand new, and we're part of a big organization now, a multi-billion-dollar company, and we have an established infrastructure with our own HR, legal, marketing, IT, finance, and a lot of that, when you're kicking off a company, we're happy to piggyback off of that infrastructure to get the company mobilized and moving, and all the services that can come with that to get the group going. And the real goal with all this is get the company up and running and successful on their own 2 feet. Program management is another one, laying out that org chart, group identification, roles, responsibilities, and then finding the right talent, handpicking them if they're in our network, or just connecting the folks and getting that streamline of candidates. The other part of the talent that I'll hit on in the talent bottleneck is also building a strategy for homegrown talent, training capabilities. Humbled that we have a Project Pharma University, our firm engineers named it that, springboarding that, making a way to train folks. So when we have a feeder university in, we can train people, recruit people, and mitigate that business risk around talent. Manufacturing execution, this kind of covers the gamut of what it takes. Once that CapEx is approved and we need to mobilize, we'll backfill roles as owner reps, from program managers, validation, quality, engineering leads, automation, and then we'll fill in the roles from an engineering, URS, through PQs and SOPs and maintenance plans. So we'll come in and bring in the cavalry, and at the same time help onboard people and then adjust our roles so we can get that company up and running. Here kind of shows you a lot of the work we've done in this space. A little outdated, but we've done over $4 billion in CapEx in the last 4 years. Tons of ATMP, advanced therapy facility builds. Also, in the blue there, you'll see we've also partnered and evaluated CDMOs and ignited over 80 now CDMO engagements. So you can see how you need to mobilize and move fast. It's not one or the other. There's definitely a hybrid that happens there. And then on the right, it breaks down all the capabilities that we have in the space. Project management, capital project, we do a lot of that, and lead a lot of CapEx, kind of be that one-stop shop for an organization. Project controls, facility layouts, we'll collaborate with A&E around the types of pods or modular walls or stick build and what that's all going to look like. We'll evaluate select CDMOs and CROs, and do a lot of owner rep FTE backfill in that regard. These are the types of capabilities that, validation for us, and I'll just dive in. Validation to us is the process engineering through PQ. We believe that there's a very big value in understanding the engineering when you're testing the system, and then also embedding those quality by design principles upfront in those user requirement specs, evaluating the vendors, making sure we can understand their packages, what we can and can't leverage, and then qualifying appropriately, commensurate with the complexity of the system. And then we got the quality, arm there. That's auditing vendors, evaluating CDMOs, establishing quality agreements, doing a ton of data integrity, even backfilling roles where we review and approve engineering and qualification documents. And then the bottom right, you got the reliability and maintenance, right? So, it's all related to operational readiness. It's not enough to just buy the equipment or engineer it or validate it. We need to think operational readiness, get this facility up and running. So this is where we think about policies and procedures to operate and maintain the equipment, calibration and maintenance, and basically mobilizing our GMP assets. This deep dives into the validation services. We build out the infrastructure, we create the programs, and then we execute them. We definitely recommend and employ a commercial off-the-shelf or COTS program to be more of a streamlined risk-based approach, because the systems are more standard. So have the testing be a little more abbreviated and standard. We follow quality by design principles, GAMP principles, ASTM E2500. So we highlight those principles on the left there. And these are tried and true approaches that we've implemented where we created the program and executed it in the advanced therapy space, in the cell and gene therapies, and now they're commercially approved products. So really, really proud of that, and proud of the team, and proud of the entire ecosystem that came in, helped with this. And it was definitely a group effort across the board. Project Pharma, part of Precision Advance and Precision Medicine Group. So Precision Medicine Group is, we're part of Precision Medicine Group as a whole, over 2,000 employees, 400 products. They work with 30 of the 30 top biopharma companies. We're honored to be a part of this organization, backed by the financial institutions highlighted there with Blackstone, TPG, Vita, Berkshire, and more. And it's a great organization. It's a strategic approach, and that's how we rolled out Precision Advance. Got our clinical with Precision for Medicine Group, manufacturing with Project Pharma, and our tech execution, and then commercial synergize this, a more efficient collaboration with the client, less vendors to manage, and then we can really collaborate across the whole value chain and bring things forward faster and more compliantly and efficiently for the patients and the companies in the place. So with that in mind, the collective experience is massive, over 75 cell and gene therapies. We'll go all the way to the right there. We were part of FOIA Facility of the Year Award, one of the facilities that we near and dear to our hearts. We were a part of a company that was very small and privately held, went public, and to get that award was a great recognition, and to be a part of that was really, really flattering, and really proud of everybody that was a part of that. But really great compliment for the organization. And then I'll just leave you with this. I mean, this is how we founded our firm. This is how we like to kick things off, and this is how we like to close things out. But PF cares. It's our patient-focused culture. So it's important to everything we do. We're really proud of the retention that we've had and the great leaders in our organization. And it's important that we understand why we're doing everything every day. And it's for these patients and giving them hope and bringing them some type of potential treatment or cure that they previously didn't even have an option for. Couldn't be more meaningful. And I'll never forget, I was collaborating with one of our clients, and it was Mother's Day, and I asked her if she would be able to work. And she said, Tony, no problem. One Mother's Day that I miss could be a lifetime of Mother's Day for someone else. And that truly resonated, and it's something I always like to share. And so with that, hope you all enjoyed it. If you have any questions, please feel free to contact corporate headquarters, Chicago office. So we're out of Bethesda. We have a Chicago location and number. So thank you so much, and we appreciate the time today.